My name is Lauren White, and this is my presentation on sporadic inclusion body myositis. So IBM, what is it? Well, it's a subset of idiopathic inflammatory myopathies. It's a muscular degenerative disease. It is extremely rare. Only 5 to 9 cases per million people actually get the disease. Over on this chart over here, it explains how the invasion of the myofibers by the cytotoxic CD8 and T cells with macrophages. So just showing how the muscle is being broken down. It is slowly progressive disease and it leads to cumulative disability. So it doesn't directly shorten your life expectancy, but it does lead to complications that do. So condition and behavior, so it begins like weakness in the more distal extremities of the upper limbs and proximal in the lower limbs, which kind of makes it different from some of the other myositis because of this feature. So it's the things that are kind of far away as shown in the upper limbs in this diagram, and then your quadriceps, and also affects the oropharynx, which is the middle part in the back of your throat, and it also presents with edema and dysphagia, so swelling and difficulty swallowing. Let's see, so what does it look like? So when I try to explain it to people, I tell them it's similar to ALS, just kind of, it has a lot of similar characteristics. So here is a diagram up here of kind of what the asymmetric finger flexor weakness looks like, and then this middle picture just shows how much the muscle has been deteriorated in the quadriceps, so everything just gets a lot smaller. And the last picture is my stepdad, who was diagnosed with IBM, and it was kind of very shocking for him. He was, very athletic and a rugby player and former military, so it just came out of the blue. Never saw this one coming. So the risk factors, there really aren't any that they know about. He was in the military, and so they are looking at some sort of a correlation there. He did participate in one of the studies, I think, done by the NIH, and just looking if there was any correlation. He worked in the Army. And so the aging process is also associated with IBM. And so this study in particular was a retrospective cohort analysis, and it just looked at people who had IBM and compared them with people who had IBM in the military, and the results just showed a drastic decrease in the survival rate, with the mean being of 8.5 years. So that you can see that right there. And I thought it was interesting. They also found a link to bronchiectasis, lung scarring and fibrosis. Were also linked to the service members that were studied, and I found that interesting just because my dad, his lungs were just so weak, and I could never quite figure out why. So person, place, or time, just kind of what I've already explained. So it can happen to anybody, but the symptoms usually present at age 40 and up. I know my dad was on the younger end of this, but age 50 is kind of the most common age. It's predominantly more in males and Caucasian males, and they think the environment, what people are around, exposure also plays a role in how you get the disease. Place and time, there's not really a specific place or region that IBM affects more than others. It's seen all over the world, and I would say it would have to be a secular trend for time measurement, just because of its long duration. It doesn't really fit into the other categories. It's not cyclic, it's not short term, it's not a point epidemic. So that covered that. And so the primary prevention, there is no specific cause. So the prevention for the development of the disease is it doesn't exist. So that part does not really apply to this disease. Now the secondary prevention, this is where all the stuff kind of happens. So the screening for IBM is super challenging. It's like 3-part test, so that's why it's often misdiagnosed. People just think they have arthritis, or even polymyositis, they think it is. ALS, could be a lot of different things. Or they think they're just clumsy. So it's underestimated, and it's difficult to differentiate it between the other IIMs. Uh, the testing has to be clinical, electrodiagnostic, and pathological, and it includes like a muscle biopsy, which is, you can see up in this slide over here what the muscle tissue actually looks at. So I think when people are going to the doctor for a checkup, muscle biopsy isn't usually something, the first step of anything really. So that's probably another reason why it's diagnosed, or people aren't figuring out they have it for a while. Most the treatment, it's also progressive, and they always recommend OT, STPT, all those kinds of therapies, just kind of as a different way for teaching the people how to manage their disease. This little graph just shows that it mainly improves their quality of life if they participate in those activities. I think a lot of people find that they don't want to do them because they're not seeing like the actual benefit. If they're doing physical therapy, there's no, they're not gaining muscle strength. They can never get it back. So it can be super frustrating. I think we found that the speech therapy was beneficial. It taught him different ways how to swallow, and the other therapies showed him different finger exercises. Let's see here. So treatment, they need all kinds of treatment. So I know with my dad, going from like this athletic, guy, I think he first thought something was wrong, when he had he lost his balance and stuff. And so, and I think it was very difficult for him, a little embarrassing, that he needed to use assistive devices. So he began with, a cane, and then he went to a walker, and then a manual wheelchair, and eventually a power chair. And, as their muscles just keep getting weaker and weaker, they're no longer able to push themselves in a wheelchair. So there is no cure, like I said, and no standard form or course of treatment. The standard progression, just kind of what I already went over. And it's also generally unresponsive to corticosteroids and immunosuppressive drugs. So there's really no medication to kind of treat it. They need a lot of equipment, I will say that. So early on in the disease, they require things like a weighted utensil just to kind of get the food from their plate to their mouth, and eventually they will need to be fed completely. Here's a cough assist advice. It just simulates a natural cough. It clears their lung of mucus and phlegm, makes them easier for them to breathe. Transfer boards, catheters, Hoyer and ceiling lifts. We had ceiling lift installed in the home itself, and that just saved all of us because we were not strong enough to lift him anymore. And we did find the passive range of motion exercises to be super beneficial. It just kept his circulation going and prevented blood clots. So I definitely think that is a good treatment. The tertiary prevention, since there is no cure, the treatment will continue throughout their life. It eventually, will progress to palliative and finally hospice. And so, but they usually do recommend aquatic therapy or pool therapy, and I highly recommend this. I think it transfer them from their chair, and this little lift thing lowers them down into the pool, and it allowed my dad to feel more like a human. He was able to float around and move, freely, and not just be confined to a chair. So that was super important to him. And my dad did not make it. He passed during COVID, and I'm sure you all know how weird of a time that was. And so a lot of his therapies and the things that kept him going were just taken away. He could not go to the pool. He couldn't go to the store like he liked to do, and just run around on his power chair. So I guess it's just such a terrible disease. It just robs a person of their whole mobility, and so I think that's where it's a challenging disease, because cognitively they are still there. It does not affect their brain. It's just physically they lose all their everything they used to be able to do. and that is challenging, and sometimes that's harder than, I think, looking at death itself. So he did remain positive throughout his illness, and he had a huge amount of support from the VA and, of course, all of the family and everything. And so what I wanted you to learn from this is, because I had never heard of IBM, and it was so, we went for years with just, we didn't really know what it was. We knew something was wrong. So I just hope, bringing awareness to that this disease is out there. And so the future, I just hope more research and studies could be done to not only find a cure, but maybe a way to reduce the symptoms, or at least combat, or slow the progression of the muscle degeneration. Because I think, with as awareness and better understanding of what the disease actually is, I think an earlier and accurate diagnosis can be achieved, and that is what I hope for this disease. Thank you for listening to my presentation, and here are my references.